Hello, this is Dr. Gay from First Look MRI, and this is a 54-year-old female with medial-sided knee pain, and she has lots of marrow edema throughout her medial femoral condyle and her medial tibia. And when we see this pattern of marrow edema, we worry about the meniscus not doing its job. This is the patient's lateral meniscus, this dark wedge, and it fits right in here tight, and it acts as a shock absorber to distribute the stress out between these two bones here, and it's doing a good job. But now this one, we see the meniscus is pseudo-extruded. It's out a little bit, so it's not tucked in there tightly. As we go towards the back, we see the problem. There's a little fluid collection within the meniscus. So this is a radial tear, and with this type of tear, the meniscus is no longer holding on tight. This is drifting outwards, and it's allowing the femur and tibia to contact each other. So with axial loading, this will squirt out even further, and the bones will hit together, and the patient will develop abnormal stress. And so this is an example of marked stress reaction related to this meniscus tear. Oftentimes a tear will occur, and it's just a small tear at the top or bottom, and there is not loss of the tensile strength, and it doesn't cause significant abnormal stress. But in a case like this, with a radial tear, the meniscus drifts out and it really doesn't perform its function very well at all. And then we get a problem just like this, and marked stress reaction, and this can go on to fracture if something is not done quickly. One other thing interesting in this patient was the anterior horn. This is the patient's posterior horn tear of that medial meniscus. But if we go to the lateral side, this is the patient's posterior horn, a nice triangle. This is the anterior horn, and we see this little dark band. This is a transverse ligament. It comes off the anterior horn of the lateral meniscus, goes across the midline, and it blends in with the anterior horn of the medial meniscus. And so we can see it blending in over here. Looks good. But over here on the lateral side, we see there's a little separation. So this is where the transverse ligament is partially torn and kind of stripped away from the anterior horn of the lateral meniscus. So partial tearing, stripping of the transverse ligament as it blends in there. And that's it. Thank you very much.